Welcome, this is Keith Ronan from Positively Osceola, and today we are having a community discussion with leaders that provide information and services pertaining to the opioid crisis, substance abuse, and dependency in Osceola County. With us today is Belinda Johnson-Cornett, CEO, Osceola Healthcare, FQHC, serving the underinsured and uninsured population in Osceola County. Tom Griffin, CEO, The Transition House, treatment provider for substance use and mental health. Sergeant Frankie Della Rosa, St. Cloud Police Department, experienced street officer and now the public information officer for the St. Cloud Police Department. And Mike Kapranica, Division Chief, Osceola County Fire Rescue, providing initial treatment and medical treatment during transportation to the closest hospital emergency room. Well, hello everyone, and thank you for taking the time to be here with us today. I know you all have very busy schedules. The topic today, of course, one of a serious nature, and discussions like these can be a catalyst for solutions in a community like Osceola County. Well, let's get right to it. Our first question to the panel: is there an opioid crisis in Osceola County? Anybody?
There's an opioid crisis in the entire nation. But when you start to look at, what's really gone on here, I know when I first, relocated down here to Osceola County, I took a job as a substance abuse counselor. And you never, ever, back 25, 30 years ago, saw a client with an opioid dependence coming into treatment. It was strictly alcohol and crack cocaine. And now today the dynamics have changed so much that the majority of our clients coming into treatment have an opioid dependence. And it's been left untreated for a number of years. The number of opioid overdoses, the crises that are involved, the police statistics, all of the data that's collectible supports the fact that we do have a severe opioid dependence here in Osceola County. And the fact of the matter is there's not enough being done about it, and there's not enough public awareness so that the families of those that are afflicted with the disease really know what to do and how to react and who to call and how to go about making those calls. And that's what I want to focus a lot of this discussion on, is how do we find help for those that are addicted.
What has changed to make this crisis take place?
The big change really came about as a result of the pill mills. That was the initial start of it all, and the easy access to the Oxycontins and all of the opioid based over-the-counter medication. When you really look at and they've done surveys and looked deep into how someone starts on their opioid dependence, many of the first-time users actually obtain the pills from some friend or relative, right inside the house, because the opioids, at least in my opinion, have been overprescribed and too freely prescribed to a lot of people for pain. And that creates the access for teenagers and whatnot to go into the medicine cabinets at home and start to help themselves and take them, and eventually that creates the addiction.
Right.
There were more opioids, prescription drugs sold in this country than were manufactured here. They again were being manufactured in foreign nations, smuggled into this country illegally, and then sold illegally.
I think too, another part of it is the potency of the stuff that's coming into some of those illegal drugs. They're cutting it with fentanyl and some stuff that's pretty strong. So I think that addictiveness of that drug is even more enhanced with that. So we see that in the field with the amount of Narcan, which is an antidote to that opioid, having increased those doses. We've seen patients literally that we've brought back from the brink of death and transported them, and they're right back out the next day, finding another fix because it's that addicting to them. So yeah, I've heard many stories of that in the field, and it's quite tragic, and it's kind of rough on our guys too, because they're seeing this thing over and over and again, and trying to find help and hope for them. But that's just part of it, and hopefully we can figure out something as a nation to kind of fix this problem. Probably one of the most effective things in the field for saving lives is actually the law enforcement and Narcan being issued to those guys. Because a lot of times there's more of them in the field than us. They're the first ones there on those calls. So, hats off to law enforcement and Narcan that they're carrying now. And
so to touch on what some of Tom said, when I first started here in 2008, we rarely ever responded to calls for services. that involved someone overdosing on a narcotic. You fast forward to 2010, we started seeing all the pill mills come up, especially here in Central Florida. These individuals started being overprescribed medication, and it became easy access to other individuals who did not need to have this medication. Law enforcement got involved. The state of Florida created some statutes and provided us with tools to better start investigating these pill mills. We were able to put a stop to them, but then we ran into the problem of we cut off their supply. Now we have a bunch of individuals out on the streets who are having a pretty much, detox on their own, and they don't know how to go about it.
Right.
Then around 2013, while I was in the narcotics task force, I started to see an increase in heroin all of a sudden. It started coming back. And that's as a result of all the pill mills being shut down, and everybody who was addicted to opiate is now turning over to heroin. And unfortunately for these individuals who are getting these narcotics on the streets, they don't know what they're truly buying.
So we have a full array of services, beginning with pediatrics to maternity, dental. So we see this in our sites when we do a screening on everyone, a mental health screening, substance abuse screening. And so we've identified patients who have issues or potential issues, and we're most concerned with those who are pregnant. And so we refer them to our partners like Transition House for ongoing counseling and substance abuse care, because we have seen those numbers increase, those who even through the screening, identified through the screening or self-identified. And a lot of people come to us for pain management, which we don't do, so we refer them out to the appropriate partners in the community.
What might some of the signs or symptoms be to watch for if I suspect someone I care for might have a problem?
First signs and symptoms usually are changes in behavior, loss of interest in things that normally gave you a great deal of pleasure. Just lack of enthusiasm for life, social isolation. You can look in their eyes and the pupils are dilated and small. Changes in appetite. Somebody that may be having nausea, a lot of nausea, constipation, diarrhea, signs and symptoms of that. But I mean, the big thing to really watch for and look at is the changes in behaviors, the social isolation, as I said earlier, withdrawing from family, withdrawing from loved ones, withdrawing from all the normal daily activities that, again, people used to really enjoy. Very often you'll see, they don't take care of their physical appearance, not bathing, showering, not, wearing the same clothes a couple of days in a row. It's just, total apathy and lack of interest, almost anhedonia.
So I have an 18-year-old child, and I'm always concerned, what's the exposure to certain groups? How much is he being moved in some peer pressure areas? So we look at all those things, and then in our case, we're with him constantly, poor kid. But and I'm pretty darn sure he's good in that area. But I think it's challenging because I don't want to believe that he could be going down that path, and I think that's the beginning of the problem. Maybe I don't want to think that could be possible, and it is possible. You must see that in the community with the young people, with students certainly.
Easy access, they get to it, they experiment with it, and then they start sharing it with their friends. And of course, everybody wants to not look cool in front of their friends, so they go along with the experiment and now become addicted to this medication.
It requires constant vigilance today. It's not the way things were years ago. People really have to be in tune with their children. They have to be in tune with their loved ones. Like with an 18-year-old, all you have to do is just look at how they're doing in school. That's a good sign right
Sure.
there. I mean, has he lost interest in school and school activities, sports, or any of those types of things that usually that once drove him to, be who he is.
All right.
And again, even with all age groups, it just requires constant vigilance that we all watch out and protect our loved ones and go back to being a tight-knit family.
What are the first steps that anyone with this problem can do to get help?
Or they could simply call us a transition house, because, one of the things that has really come about in the last few years, having done a lot of study and research on the opioid addiction, is a whole new concept which is called medication-assisted therapy. And the medication-assisted therapy is made available to us through some contracts that we have with the state of Florida and the managing entities that manage this area, so that if someone is addicted to opioids and they withdraw from that, while engage in treatment, we have certain types of medications that we could prescribe and administer to the clients that actually reduce the cravings and reduce the need and the dependence on the opioids, which allows them to be able to fully participate in treatment and be cognitive, be aware of what they have to do, and fully invest themselves in recovery. And it just makes the recovery process a whole heck of a lot easier than the old-fashioned way of just putting someone in a detox and having them go cold turkey and withdraw from heroin or any opioid-based medication.
How does it connect between tragic overdose and treatment?
Well, once we take them to the hospital, they get treated there, and basically they're getting them, weaning them off that medication or off that illegal drug they've taken. From there, a lot of times I think it ends up being them just signing out AMA against medical advice. You ruin their high, and they're just so addicted to it, they don't want to hear anything else but let me out of here. Most of the time they're agitated too, because coming out of that.
Right.
So it's that there is a disconnect there, and how do we get them to to a treatment or something like that? But they've got to want it too. That's a lot of things too. I think when they're in that place, they've lost kind of hope. That it's so addicting to them that they don't know how to get outside that loop.
And I think some of the intervention before that, many people have a trust in their primary care provider, their doctor, the nurse that they may see, is really communicating, some concerns that they may have, whether it's with themselves or their children, things that they've noticed or things that they're going through, and we can connect them to the appropriate services to have some preventive type of services for them as well.
We're talking about what happens when the crisis takes place, and so, talking about treatment, talking about paths to success in the future.
You never hear a good story that was like, hey, my life got better once I started doing heroin. You never hear that. Well, take that, that kind of like bit of information that don't start it. There's nothing good comes from this. It's a dark road that you don't want to go down.
Denial is a common and it's a very strong trait. They deny the extent and they deny the depth of the addiction itself. They actually deny all of the negative consequences that have come to play in their lives as a result of the using. And they make up excuses, and they'll do all this rationalization and justification for various different things that have happened and gone wrong, simply so they don't have to face the real hardcore truth that it is the addiction and it is the drugs that have created the problems in their lives. And the families have to stay united. They very often, we do what's called an intervention, where the family gathers around the addict and relates the stories and the concerns that they have, and basically gives them some ultimatum. So it's time to go to treatment and get clean and start to face life on life's terms and do what you're supposed to be doing.
I've personally handled calls for service where I've had family members contact the police department on behalf of another family member because they're concerned for the individual and are trying to seek help before that person end up overdosing. And I've also had it where a family member has come to us after the fact and thanked us after an incident and said, hey, you guys, thank you for responding and having the Narcan readily available. You were able to save my son's life, and now we've got him into a program and he's seeking the treatment. So I've experienced both the positive and the negative side of it, and actually seen family members come forward and help that other family member out.
Obviously, if somebody gets into a substance abuse issue, whether they started with prescription drugs and now they have to go out on the street to fulfill that need they have, that's not a free scenario. So that's got to cross over and impact law enforcement.
You'll see our vehicle burglaries will start to increase because now this person is out here on the street trying to find their next fix, so they start pulling door handles, hoping to find an unlocked vehicle.
Right. What kind of treatment plans are out there? I mean, we know we've talked a little bit about that, but how are they paid for? How does that happen?
The first, obviously, is your own private health insurance. All of your health insurances cover substance abuse treatment. Again, we can go back to, the new laws that have come in, regarding the Affordable Health Care Act, and, more and more people have insurance. Florida used to be, and still is, to a very large extent, one of the highest ranking states for working people without health insurance. The state has some programs, and the state, funds a lot of the various different programs. Through our outpatient centers here in Osceola County, we, again, I'm going to go back to the medication assisted therapy that I spoke about. We have two programs, one of which is called Suboxone, which is a pill form medication that you take on a daily basis that reduces the cravings for heroin and for all these opioids. The other one's called Vivitrol, and Vivitrol is a once-a-month injectable medication that you take for a short period of time as well, and that reduces the cravings for both opioids and alcohol. Because many of the people that relapse, that are heroin addicts or opioid addicts, will relapse by taking alcohol first, and alcohol is a gateway drug that lowers your inhibitions and allows you to move back towards the the drug of choice, whether it be heroin or the Oxycontins or whatever they may be. And these are all paid for through the state. And these are all state-funded programs, and they're accompanied by treatment on an outpatient basis as well, because the medication-assisted therapy alone will not work. It has to be in conjunction with therapy, and also in conjunction with the full commitment of the individual who is addicted.
Gotcha. And so it's not something that you would be prescribed and then take care of that yourself. You need to have that therapy along with it.
You need to have the therapy along with it, and also you need to have the medical services that go along with that as well. It's a combination of all three.
Understood.
And again, I'm going to go back to the full participation and cooperation of the addicted individual.
So, Tom, you spoke of those individuals who are dealing with substance abuse that are insured, and I know that you deal with people who are underinsured or uninsured. How does that affect you?
So for the uninsured, regardless of their ability to pay, we provide services to them. And so when they're uninsured or underinsured, they pay based on their ability, based on their income. So they pay a percentage of their visit or nothing, based on their income. And so what we do is we have a case manager. We receive federal funding, have a case manager and some social work services that we do to address, to begin the process of identifying those patients and then referring them to community partners such as Transition House to provide the addiction services that we don't provide. But we make sure that through that partnership that those needs are being met, and we continue to meet their medical needs in conjunction with their behavioral health, substance abuse needs in partnership with Transition House and our other community partners.
Awesome.
The Vivitrol and Suboxone programs that I spoke about a few moments ago, those are state funded.
Yes.
Gotcha.
So they are for uninsured, they can be for the insured, but they are primarily designed for the uninsured or the underinsured person that otherwise wouldn't have the funds or the ability to get treatment. Those that have major insurance, their insurance companies will pay for both the Vivitrol and Suboxone as well. So basically, to make a long story short, everybody is covered.
For our uninsured, we see them based on their ability to pay. So we don't turn anyone away, based on their ability to not be able to pay for that service. So we base it on their, family income.
Another common trait amongst people that are addicted is they have a feeling of helplessness and hopelessness. And those feelings loom very large in the minds of those that are addicted. That there's no hope for me, that there's nothing that can be done about this. This is my fate, so to speak. And they tend to follow through with it. Yet those that are family members and those that are involved or loved ones of those that are addicted, they are the ones who really need to know that there is a solution, there is a way out of this, and all they have to do is simply pick up the phone and call. And from that they can get some directions and they can get some guidance, and the treatment is available and the treatment is paid for, through the state. The Vivitrol program has been very, very successful. The Suboxone program is very, very successful and has been going on for years. Both of these programs have been going on for years. They're tried, they're true, they're tested. They've met all of the tests and demands that could be put on them. So that there is an answer, there is a solution. Somebody just has to take the initiative to make the phone call and step forward rather than just sitting there and just, loving the addict to death. And that's what many families do, is they just love the addict to death.
Once someone has entered into and followed through with treatment, do you see individuals relapse?
One of the concepts in treating substance abuse is that you're treating a chronic disease. I mean, no different than cancer or diabetes or high blood pressure or any of the other chronic diseases that go on in this country today. Very often, many people will relapse. Many people will not. People talk a lot about relapses because the person who relapses, they create quite a bit of attention in the family and the community. The person who doesn't just sort of goes off and blends into the community and becomes part of our community. Relapse is not a failure of treatment, it's not a failure on the part of the individual. It just basically is an indication to us that there are, deeper, more underlying issues that need to be addressed, and that they were not fully addressed on the first go-around or the prior go-around. And it's time to come back and basically redo what we did before to a greater extent and greater depth than what was once done. And the individual himself has to do some more homework on himself and address the issues as to why he's relapsed and why he's back into an addictive state once again. It's just, for many people, it's part of the process. It's not something to be looked down on or frowned upon or scolded or anything like that. It's an issue that just lets us know that that person needs a little more love, a little more attention, and it's time to embrace that member of the family.
And one of the things that I think is important that many of these programs do is to look at some type of early intervention. So as I mentioned before, when we do screenings, we do depression screenings. And so if you can identify somebody who may be having some issues related to depression or other emotional kind of social issues that are going on, and then refer them for further counseling. Sometimes you can identify those of potential or those who have already initiated into the drug use that we may be able to prevent from that overdose moving forward.
When they do make that phone call to 911 and they're trying to report someone overdosing, that they're not 100% truthful as to what's going on. It's always, I don't know what happened, he just passed out. And a lot of them clean up the scene before we get there. And it makes it hard for us to determine whether this person's experiencing an overdose where we need to deploy our Narcan, or they're experiencing some other medical issue that we don't know about. Yes. And there's actually a statute out there that grants immunity to these individuals who try to come forward and report a case of an overdose. They are immune from prosecution. The state attorney's office will not file charges on them. And a lot of people don't know that. So they decide to clean up the scene before we arrive, and then we get no cooperation, and we just have somebody laying there and nobody knows what happens.
All right.
That unresponsive patient mimics a multitude of different types of medical conditions that we're trying to treat. So yeah, if we can get that more information on the front end, that helps us immediately be able to treat what we need to treat to help save a life.
Well, obviously, this is a complex issue to tackle in any community, but with positive solution-based discussions like this one, I believe our community can be impacted and inspired by leaders such as yourselves. So thank you very much for being here today. Again, I am Keith Ronan from Positively Osceola with Belinda Johnson-Cornett, CEO, Osceola Healthcare, Sergeant Frankie Delaroso from the St. Cloud Police Department, Chief Mike Capronica, Osceola County EMS, and Tom Griffin from the Transition House. Thank you all. Together we're making a positive difference in Osceola County. Thanks for watching.